Good evening, friends. I'm Dr. Venkatesh, consultant urologist and renal transplant and robotic surgeon, Kaveri Group of Hospitals, Hosur. And I'm also your urology faculty from Team RRM Next and DocTutorials. So today, with the latest INI SS November 2025 session as results have been out, I'm really happy to welcome Dr. Vidya Sagar here. So welcome, Dr. Vidya Sagar. So he has secured an amazing rank of CML and AML 2 in the last session of INI SS Urology session. So many congratulations, Dr. Vidya Sagar, on behalf of our team and DocTutorials. So we are really happy to have you here. So thanks for giving your valuable time. So please introduce yourself, Vidya Sagar, so that all the viewers and students also will get to know about yourself.
Thank you so much. Uh, my name is Vidya Sagar. I have done my MBBS from JIPMA, and after which I did my MS from AIMS New Delhi. I completed my course in this year, so September.
Okay, so you're already an Amazonian. Okay, so that's great. That's great. Okay, so you just finished, right? So probably you hardly had about 3 to 4 months post your residency, right? Not
Yes,
even
sir.
3 months, I guess. Okay, okay. So just please briefly tell us what made you to think about urology as your super specialization. So because most of the times residents as MS residents we are exposed to more of this surgical onco and surgical gastro. The rest of the
Yes.
other specialties we don't get to have a great interaction. So especially with urology, it is completely new. Even when I am teaching, it is very difficult for me to build in the concepts from for the MS residents because they don't have a basic idea of what urology is. So what made you to take up urology? So how did the interest or inclination towards urology begin with Dr. Vidya Sagar?
It actually started from my MS period. Like in my unit, there used to be renal transplant. So
Okay,
during that time, like it was like more fascinating, and many people are not doing in other units. So I
okay,
thought like it started with it, but then
okay,
after hearing about it, then speaking with others, then I decided
okay.
that this will be better.
So that's nice. So you will never even regret about it. Urology is a very enterprising and fascinating field with a lot of specializations coming up. So new horizons are opening up every day. So you will definitely get in love with urology more and more once you get into your residency as well, Vidya Shankar. Okay,
Yes.
so just briefly tell us your preparation. So because I think you hardly would have had 2 to 3 months for your preparation. So when did you decide that okay, I'm going to give a serious prep into your this INISS, and I hope this is your first attempt, right?
It's the first attempt.
Oh, that is phenomenal. Securing such a great rank, even the first attempt is even phenomenal. So that speaks about your core knowledge and preparation you had. So just briefly take us. What were your materials you had for preparation? So when did your actual preparation start with Vidya Sagar?
Uh, I was actually like whether to take GI surgery or urology. I was had to decide. So after my exams in June, like I thought I'll take 1 or 2 months to decide this. Then I actually find in August itself, I was like sure I will be taking urology and no other
Okay.
like subject. After that, I started like seeing what all resources to use, speak with multiple people. Then my course completed by September. Like September 15th, I started like real studying. Like
Okay,
started my
September. Okay.
first is then first I had seen your like videos actually, all your videos. Then like around 7 days I had completed all the videos. Then after 7 days I thought like I should make notes also. It won't be like possible for me to like rewatch it again and again. So I started
So,
making the notes. In 7 days I made the notes. Then I was revising that notes itself. So
so your core content was the entire video lectures from us from DocTutorials, and you made a notes on your own from those contents. So you mean to
yes.
say those lectures and the contents in that it's sufficient to crack through the exams,
Yes,
or that were
along
your
with
basic skeleton?
this
Yeah.
was the basic. Along with that Q bank, like previous year questions and the like GTs, all this like I added to my notes and I kept on revising that.
So the basic funda or the strata is the whole content from our video lectures. Okay. So I would like to ask out of curiosity. So who introduced you that there's a platform like this for urology? So was it your own search or some of your seniors who guided you on that part? Can you just throw
I,
some light on it?
uh, yes, like I asked my seniors, like most of my seniors were telling that you're like for starting have to do from DocTutorials itself, because we like if you don't have any base you cannot like straight away jump into Campbell etc. And I didn't have
Okay.
time also to rate Campbell, so I thought
Okay.
like I'll follow only your like I saw like different platforms videos once,
Okay.
then I finalized that I'll see your videos, because like I was able to grasp more in your videos, and it was like more of chalk and talk method of teaching.
Okay, okay. So that's nice. So, so then how did it go? So were you giving your grand test? How did your revision go, Vidya Sagar? So were you giving the grand test? How were the MCQs? You were solving the MCQs, right? So how did you allot time cutting it? Because many times students tend to ask these kind of small questions as well, which I feel is very practical. See, because see many times the doubt is like, sir, I have a neat SS on one side where I have good number of seats, but the pattern is completely different. I'm going to cram through the general surgery. On the other hand, I have INI SS where the seats are very limited and you have to get through a top 20 rank, but the seats you are going to get are from very top institutes from across India. Okay, but again here the pattern is different because I have to read core contents of urology along with general surgery. So many students ask me the same question, sir, is it really worth to give a shot at INISS? So what is your answer? Because what made you to think that okay, I can crack through INISS? Because like students, more even you would have gone through the same kind of a dilemma for a short way. Okay, so what made you strongly believe in that? And just briefly throw us your inputs on thoughts on that, Vidya Sagar.
So like when I completed it was like during September at 2 months. So that time like reading for INS is actually easier compared to NEET SS. Now once you
Why
see
do you
like
why do you feel so? Because
in
I
that you
also
have to
feel.
read.
Hmm.
Yes, the main thing is the syllabus is more actually NEET SS. You have to read all the sections. You have to read the substance thoroughly again, and it will take more time actually. This is
Okay.
like I had finished my urology. Like I made the notes and saw your videos in 7 days. In a very short
Okay.
span, I had seen your videos and had made notes of it also in only 7 days. That won't be
Okay.
possible. Like it is very difficult. And thing is, competition is also less. People are also preparing less, and seats are
Yes.
also somewhat less.
Yes.
And like everyone wants to do it in like if they want to do a MCH, they want to do an INI.
Yes. So
So like it's
actually,
good.
what you are saying is you're taken it in a very positive way. People think only about the number of seats which are less, but what you have summarized is very beautiful because the paper is standard. You don't get a very difficult question or something. Most of them are concept-based questions. Number two, it's a relative examination. Not many students are giving, or are those who are giving, not very, only very few are giving their heart and soul and preparing for it. And what I've understood in mentoring all these students the last 3 4 years is all those who have definitely put in their heart and souls in it and prepared seriously for about 2 to 3 months, most of them were able to crack through the exams or at least to qualify and get into the departmental assessment. So that is for sure because easy. And one more thing is now though the pattern is different, difficult, not many are going through Campbell, of course, which is not possible in a given short period of time because Campbell itself is a very vast textbook. But now, since we have a very concise way of bringing out those contents in lecture forms and video lectures, it is easy. So invariably, all the students are going to go through the same material. So it is easier for you to go through it. So you have taken it in a very positive way, which I would always advise all of my students also to think that way. Okay. So on other end, you have to go through Campbell, Subiston, where the exams are more factual. The pattern is very not standardized, so there is always a delay in the exams. Whereas INAS is a sure shot. 2 sessions every year, the seats are standardized. There is no doubt about it. It just happens on fixed dates. All you need have to is believe yourself and you have to rewire your thinking. That is what I believe. So you have definitely hit the bullseye in your way of thinking, which actually helped you in cracking through the exam. So that's nice.
Yes, sir.
So what are you planning to? Which institute are you planning to take up Vidya Sagar?
So AIMS Delhi itself.
So you're going back to your alma mater itself. Okay, so that's great. So before you wind up, just 2 minutes of your what are your guidance for your juniors as well as your fellow colleagues who watching this interview, who would have narrowly missed on or who are just starting to thinking about preparing for INI SS Urology. So what are your thoughts? Your please share your one or two couple of advices to your fellow colleagues and juniors, Vidya Sagar.
Like I would like to say that if you want to do urology, everyone wants to do it in a INI institute. So when you have a chance, and this is the best chance you can get, and the exam is also standardized, and question paper is also standard. So if you prepare thoroughly with your heart and soul, you can surely get like good rank to be placed in INI. So everyone should try to give the exam with their heart and soul. Yes.
So thank you so much, Vidya Sagar. On behalf of our team and myself and RRM Next and DocTutorials, I thank you. I congratulate you again and thank you so much. All these
Thank you, sir.
inputs will definitely help you and inspire a lot of juniors who is going to watch this interview. So we'll always be in touch and hopefully we will meet in some conferences as well. So
Yes,
thanks a
sir.
lot, Vidya Sagar, and we wish you all the very
Thank you, sir.
best in your MCH, also in your future, in your life. Thank you so much.
Yes, sir. Thank you, sir. Thank you.